Hello, this is Thierry Van Bastelar. I am Senior Fellow and Co-Director of the Method Center for Risk and Resilience at Abt Associates. And at Abt Associates this year we are celebrating our 50th anniversary. So it's a fitting time for us to bring you into this series, which examines the concept of risk and resilience from a wide range of social policy areas, something that our company has done throughout its 50 years history. So today is the first conversation in this series, which sets the framework and the background and discuss the importance of this topic for donors with a particular focus on USAID. So I'm joined here by George Ingram, who's Senior Fellow at Global Economy and Development Program at Brookings, and by Nancy Lindborg, who is the Assistant Administrator for the Bureau of Democracy, Conflict, and Humanitarian Assistance at USAID. This is the schedule we'd like to follow today is going to go through first a short introduction and framework by me, followed by an interview of Nancy by George, and we want to leave enough time for questions. So we'll try to stop the interview around 2:40 so we can conclude by 3. So why are we looking at the concept of resilience? I suspect that most of you who joined the call are working on various issues dealing with people's vulnerabilities around the world. And what we have found, and I'm sure you have found too, is that people are usually vulnerable because they live in high-risk environments, and because they are forced, because of that, of making investments which are characterized by low risk and low payoff, in a sense, because the high risk level limits the scope of the opportunities they're facing. They also have small buffers that can really quickly be wiped out by small shocks and crises, and most importantly, they rarely have access to a large enough number of risk management strategies. So for the purpose of this series, we're defining resilience as the capacity of people to decrease the impact of events that negatively affect their health, livelihoods, and human development. So this basically relates to what people can do before a shock happens, which is basically lowering the likelihood of negative events, which we like to call preparedness, and or reducing the consequences of those events after they've happened, which can be called response. A simple way to show this would be through this graph where you have a choice by this individual to engage in preparedness, which could be building up savings, purchasing an insurance policy, spraying the inside of their house with insecticide against malaria mosquitoes, or climate change mitigation. Others will choose not to engage in those preparedness activities, and when the shock or crisis happens, they can choose to either have a strong response, like for example, drawing down on their savings or make a claim on the insurance policy, use pro-exposure prophylaxis, or engage in climate change adaptation. Again, here there's a change between the strong and the weak response, which would bring them at different levels in terms of vulnerability. If those two actions are taken by people who have not prepared, they can end up being, in the case of weak response following no preparedness, under a vulnerability threshold. Now, of course, on that point, on the same behaviors can take place with either preparedness or no preparedness after all the points where they've landed, followed by a shock, which will have the same reaction. So you see the possibility of people ending in weaker and weaker position in terms of resilience, or stronger and stronger, depending on the choice that they make. We also find it useful to look at different types of strategies that people have to increase their resilience. One is the behavior. For example, changing your diet, engage in disaster risk reduction, preventive care, or being thrifty. Networks would be all types of mutual support practices, social capital, savings and loan groups. Products, whether they would be physical or financial, would be insurance policies, bed nets, condoms, insecticide, vaccines. And finally, all this being supported by a policy environment that would include safety nets or regulatory environment. And what we find is that none of those strategies is on its own sufficient to give people sufficient level of resilience. For example, community building of flood retention walls is more difficult without some level of social capital. Similarly, bed nets use can be less successful without predictive behavior or without the knowledge of how to use them. Insurance policies are less reliable if there's no regulatory environment for insurance. Or your savings will be less valuable if there's no deposit protection system. So this framework can apply to a large number of development activities, and you have a few here, and I've highlighted those that we are going to refer to in the remainder of this webinar series that's going to take us through the spring. So now enough about me, and from me I would like to introduce George Ingram, who is a senior fellow in the Global Economy and Development Program at Brookings. Also serves as the Chair Emeritus and Senior Advisor for the U.S. Global Leadership Coalition and as the co-chair of the Modernizing Foreign Assistance Network. Throughout his long career, George has served in Congress, USAID, and in the NGO community. George.
Thank you, Thierry. I appreciate your inviting us to be here today. And it's my particular pleasure to have Nancy Limborg with me. From her position as Assistant Administrator for the Bureau of Democracy, Conflict, and Humanitarian Assistance, she leads not just the USAID response, but in many cases the U.S. government responses to crisis prevention, recovery, and transition. And she has particularly taken a lead in moving AID into the area of resilience, not working just for humanitarian relief and development, but bridging that gap and helping countries build up the resilience that allows them to reduce the impact of future shocks. Nancy has worked in this area for a long time. As head of Mercy Corps, president of Mercy Corps, she worked in the area of civil society, transition, conflict, humanitarian assistance. She chaired the Severe Management Committee, which was in this area. And she also was co-president of an organization that's close to my heart, the U.S. Global Leadership Coalition. We are actually very fortunate that Nancy is with us today, because while she may not be the busiest person in the U.S. government, she's probably among the 1% of U.S. senior officials who are busy. And for example, she just a few days ago returned from Liberia. And I think talking a little bit about her trip to Liberia will help us ease us into this conversation of resilience, because Liberia, with Ebola and with its prior history, obviously is on the forefront of resilience. Nancy, tell us a little bit about your trip and what you found. And again, thank you for being here today.
Sure, thank you. Thanks, George. It's good to be here. And thanks to APT and happy 50th anniversary. Thank you, Terry. You know, the reason that we have an Ebola crisis of this magnitude right now is that it overcame 3 countries, 2 of which were very, very fragile, and by definition did not have resilience. They had very weak economic, very weak health systems. And so what we saw in cases that broke out in Senegal and Nigeria, and they were contained into single outbreaks, was simply not able to be done in Liberia and Sierra Leone. And instead, you've got a virus that's viciously on the move, that's left boundaries and gone into the urban area, and particularly Monrovia. And so, you know, from my perspective, if anybody ever wondered why it was important to pay attention to fragile states, to risks, to vulnerabilities, this is a perfect reason. You know, in February, the White House announced a global health strengthening initiative, and with a long-planned meeting that occurred last Friday. And that whole agenda has come into a much stronger focus in the wake of what we're seeing with the Ebola outbreak. And essentially, it's about taking a more systemic approach and looking at how you help households, countries, systems, regions be able to mitigate and recover from shocks. And when we started this whole resilience effort, really focusing in on it 3 years ago in the wake of the 2011 Horn of Africa drought, we were very much looking at the climactic impacts that were at the forefront of our humanitarian expenditures, and looking at how do you do a better job of not just responding time and time again with humanitarian assistance, but really think about it as, you know, these shocks are going to come. How do you strengthen households, communities, systems, and regions? And that is the same dynamic for Ebola as well. And I think what we will all take away from this is that we live in an interconnected world, and these health issues are critical to resilient communities and frankly, a resilient world.
Nancy, in that answer, you've really begun to get into the policy area, and the first question I was going to ask you was, why resilience and what is it? And I think you've gotten into that now. But tell us what's new about it. I mean, as I see resilience, it basically is the joining of humanitarian and development efforts in the same space. And I assume it's new to join the thinking and the implementation. But what else is new about this, and why now?
So I'm not sure that it is that new, but what is new is the renewed global focus and mobilization. I came to Brookings, in fact, to an event hosted by Madame Ogata, who was then head of UNHCR. I think it was 18 years ago, and it was a session on the gap between relief and humanitarian and development efforts. Our communities have been seized with this issue for a long time, where there has not been that connective tissue between what happens in a relief phase and development. And it's been called a lot of things: relief to development, transitioning, the gap, it's not linear. We've been through these conversations for many, many years. What I am very energized by is that I believe resilience is a one-word encapsulation of what we need to do. It's not an acronym, which we are often bedeviled by, and it really brings a shared goal into focus between both the relief and the development side of the house, and basically says, you know what, we live in a world where if we don't think about risks and vulnerabilities as part of our long-term development strategy, we will risk our development gains. We will risk losing those development gains. There's a World Bank study that came out that says over the last 30 years we've lost 1 in 3 development dollars because of disaster, because of conflict, because of setbacks that have undermined our development investments. With the increased impacts of severe weather because of climate change, with what we're seeing in places like West Africa because of the shock of the Ebola outbreak, you are seeing development gains evaporate. And in the Horn of Africa, where in 2011 we saw the worst drought in 60 years, that was a real catalyst. And many people have heard this, but one of the first things we did is, for the first time, we started mapping where did the humanitarian efforts focus and where were our development efforts, and they were in completely different parts of the country, where you had all the humanitarian in the arid dry lands of the north and all of the development pursuing a productive growth strategy in the south. But year after year, we were putting close to $500 million of humanitarian assistance into the dry lands because year after year they got hammered with some kind of weather event, drought, floods, etc. And the 2011 drought, according to the World Bank, even though it happened in these so-called marginalized dry lands, it had an economic hit to the Kenyan economy of about $12 billion. So we can't say, oh, that's that non-productive, marginalized part of the country. These have to be factored into our development strategies.
Let's talk a little bit more about the gap that you talk about, okay? And what is it and why does it exist? And I can think of several reasons why the gap between humanitarian development exists. One is bureaucratic stovepiping, including budgetary appropriation stovepiping. I can think of technical reasons that the skills required to do each are vastly different, so you don't have the same skills in a common group of people. I can see it as the development community, policymakers, having given up on the basket cases, on areas of the world that have persistent recurring shocks, and that we've just given up on that and have stopped even trying to do development. So
I think that's a good laydown of the landscape, George. I think I would elaborate just on a couple of those pieces. The first is, I'm struck by the fact that we have so many 50-year anniversaries in the last few years. And
you mean like apps?
Yeah, like apps, like USAID. We're celebrating the 50th anniversary of the Office of Foreign Disaster Assistance at AID this week, and the 60th anniversary of Food for Peace, both on Thursday. And, what we really have is over the last 50-ish years, we have had the development world become ever more expert. We've proliferated institutions with specialization, and I've often used the analogy of the medical profession. And as you become more specialized, you become often with a more narrow view of what the problem is. And there are both institutional stovepipes and there are also analytic stovepipes. And I grew up in Minnesota, where there is the famed Mayo Clinic, and their claim to fame as a medical institution is that they take an all-of-body approach. And one of the things that resilience seeks to do is to enable a more systems approach where you have people of different disciplines and different perspectives gathered together so that you're really thinking about what is the problem that we're trying to solve, not just I have this funding stream or I have this hammer to bring to bear, because that's where you often end up with solutions that have unintended consequences, or if you're not addressing the fullness of the problem, it'll reappear in a different way. But I do think there are cultural differences between the relief world and the development world. There are healthy criticisms aimed at both by both, but there are also differences of tempo, differences of perspective. And I do think there's been, over the past decade or two, in the development world, increasingly a desire to focus on the productive growth models, which, as you alluded to, you may not always get in some of these areas that are more vulnerable or higher risk. But I think what we're seeing with the recent data that's come out is you can't really insulate that. You can't insulate against that risk by only looking at productive areas. What Kenya shows us is that even if you think you're working in the productive South, the lack of progress in the North will have an impact on the whole.
And on other neighboring countries.
Exactly.
Yeah. Okay. Gender. AID in recent years has made gender an important focus, an important priority. And we'll see it integrated across the board, both gender analysis and through program implementation. I have to assume that gender should be an issue with resilience, including that shocks and fragility probably, I'm not sure how, but probably impact on men and women differently. So is gender an important part of the resilience policy and focus, and why?
Absolutely, and for some of the reasons that you just laid out. I mean, women and really all vulnerable groups, but women have a particular vulnerability, and they also have an important role to play that is clearly recognized throughout the work that USAID does. It's a big feature of the Feed the Future programming. And just a couple of examples. When I was in the Sahel during the big drought in 2012 in West Africa, I saw not only the impacts of women because they often are left without livelihoods, or they're less able to bounce back if they don't have access to land or access to markets. But I also saw some really incredible situations where women in a community were thriving because they had been more adaptable to change and they had had opportunities. There's something called the moringa tree that many people will be familiar with. It's a very fast-growing, very nutritious plant that you can grow in a kitchen yard. And a number of women have access to this. There's some new improved varieties that are now available. And they're going gangbusters in terms of producing a whole variety of products out of moringa. They're going to the market. They were thriving even during a terrible drought. Stories where women are able to, because of improvements in their access to land, grow irrigated crops during the dry season. You know, clearly the same benefits accrue to men, but when women have those benefits, they're more likely to pass it on in terms of education for their children. I mean, there's a lot of good research on this. And so it's true for all of development, and it's especially true in resilience programs.
Good. You mentioned the drought in 2012, and you had I think a 2011 drought in the Horn.
Yep.
That was the most severe drought in 60 years or something. And some of the countries managed relatively well through that. And then the next year you had a drought in the Sahel that was less severe, but had a larger impact on some countries. Why the difference, and what are the lessons for resilience?
Well, I think one of the biggest differences is the starting point of lower development, less development progress in the Sahel. And we were really struck in looking at a lot of the indicators during that drought that the difference between a regular year and the drought year in terms of key indicators like child mortality were not that great. But what it did mean is that they were even less able to weather the shock of the kind of droughts that were starting to come ever faster. And if you look at the trajectory of the Sahel, you know, there was a series of big droughts plus food price hikes that came from like 2008 to 2012, and farmers were going deeper and deeper in debt, and they were losing their land, and you had accumulation of impacts that made it absolutely impossible for them to weather any more shocks and then recover. And this is exactly what the whole point of a resilience approach is that you enable them, households, regions, community systems, you enable them to have the ability to bounce back from those shocks instead of having your resources, your assets so depleted that you're simply not able to.
Before I move to the next question, let me invite the audience to type in your question, and I will be content to interrupt my questioning to pose questions from our listening audience. To get concrete, give us an example of how the resilience policy translates into practice. Use a specific situation and explain how you develop and implement a common coordinated humanitarian development approach.
Sure. You know, one of the things we did as we got real serious about resilience at USAID was to put together a policy that it's both policy and program guidance. So it has a specific definition, and it helped us to create something that we call joint planning cells in places where we had significant humanitarian activity and reoccurring shocks, so that we were able to bring to bear expertise and funding from wherever was most relevant to the problem set. And what that led to in the Horn of Africa was a program that, as we call it, it sequenced, layered, and integrated programmatic activities and funding from a variety of sources with the goal of taking a geographic area and really helping to address both the immediate humanitarian but also laying a pathway for longer-term development. And we did the same with a program in the Sahel that we call RISE, which is Resilience in the Sahel Enhanced. That similarly brought partners together so that there are common indicators across partners and across a set of programs that are all geared in a very targeted geographic area to building greater resilience in designated communities.
So does that mean that the change is really on the development side rather than the humanitarian side? And then in the humanitarian side, in the first 24 hours or 6 days, you're just trying to keep people alive. And so the real change is on the development side, where as you put together development programs, you build in the capacity of individuals and communities to absorb shock.
Well, I think it's really both. And on the humanitarian side, this has been percolating for a number of years. And one of the things we did with our resilience definition is to very specifically, and it's in the policy, and listeners can go onto our website and see the policy, but it very specifically incorporates approaches and programmatics from food security, from disaster risk reduction, and from global climate change adaptation. All of those areas contribute to the building of resilience and have that as a part of what they do and how they think about it. And so on the humanitarian side, disaster risk reduction, which has been around for at least a decade, is very much about a greater focus on preparedness and on strengthening local systems so that disasters can better be absorbed. I believe there's also been and will continue to need to be thought and effort in the humanitarian community about how you do the response. I mean, once you're past a very life-saving early intervention, how you do something makes a huge difference. And we're seeing this, for example, in our Food for Peace efforts, which is why food aid reform has been so critically important. In Syria response, for example, we are, because of the changes that we've already had, that gives us more flexibility to use cash instead of shipping American food overseas. We are using debit cards in the refugee communities in Jordan and Lebanon. And so if you are a refugee, you get a debit card that you go to the local market to buy what you want instead of our shipping food, having you stand in line and get a bag of rice. The importance of this is that it has a huge economic boost to the local economy. Plus, from the last conversation I had with refugee women in Jordan, they're delighted at the additional choice it gives them, additional dignity. But back to your question, there are ways to do humanitarian assistance that leads to a longer-term, faster, more durable recovery. There are definitely ways in which the development world needs to think and incorporate risk and vulnerability into a design strategy. And most importantly, there needs to be that handshake between the two so that they're sitting and thinking together. What we have seen, and what I've personally seen throughout my career, is that you'll have great humanitarian work go on in an area. Networks are built, communities are worked with. The humanitarian funding ends, and then that's it. You know, it doesn't connect to anything else. What we're also seeing is, unfortunately, many, many areas where humanitarian work is going on in a really complex crisis environment. I mean, we've had our Office of Foreign Disaster Assistance and Food for Peace programs going on in South Sudan for probably 20 years. And so you've got to be thinking about how that incorporates with ways to build systems, with ways to create, you know, that's a lot of money going in that needs to help tee up for a better future.
Nancy, I'm glad you got in a plug for food aid reform, because it's an issue that you and I both care about, and I hadn't thought about it in the context of resilience, but I see how it fits in. We have our first question from our audience, and Chris wants to hear something about country ownership and how the issue of country ownership fits in with resilience in the context of good government and country-led programming and responses.
Well, that's a fantastic question, and it's absolutely central. And again, our policy very specifically has at the center of resilience the fact that you've got a legitimate, effective government. One of the things that has been very, very important in both the Horn and the Sahel has been our work both with our development partners so that we bring greater coherence across the donor community, but doing so in a way that is in support of the regional institutions. It's EGAD in the Horn of Africa, so that we are working with those member states to develop resilient strategies and make it a partnership. So in Kenya, for example, for the first time ever, they developed a resilient strategy for the arid drylands that they are incorporating into their national development strategy, and they pledged 40% of that cost from their budget. This is watershed, because that is a long neglected area that has not had, it's so neglected that if you go to Garissa, they talk about Kenya like a different country. And so country ownership is absolutely key, but it also can't just be, as is always, country ownership means both governments and communities. And so there has been an important need to bring communities at either local level or subnational levels into the dialogue and into the planning that often is a piece of this. At the same time that we stood up this group called the Global Alliance for Drought Resilience, that's the International Development Partner Group in the Horn, the EU said, okay, we'll take the lead on doing that in the Sahel. And they stood up sort of a franchise partnership called AGIR that gathers the international donors to support ECOWAS and their member states as they develop resilient strategies. None of this is perfect, but what we've seen is a shift in how these member states of those participating efforts are viewing in their own development strategies risk and vulnerability and putting greater investment against the problem.
Over the years, there's been an increasing focus and understanding of the importance of measuring what we do, measuring the outcomes and impact of development and humanitarian assistance. Are there indicators and measurements that are used, resilience? To what degree can we measure the resilience or the fragility of a community and use that to guide what we do?
So this is always a very, very important question. It's one that a lot of really smart people are spending a lot of time figuring out because these things are never easy. And I know that IPFRI had a big conference earlier this year, I think it was in May or June, in Addis, in Ethiopia, where there was a lot of attention paid to this. So we have developed for our programs 4 ways that we seek to measure resilience. And I'll list them off for you, but we are also very much participating in a global effort to further refine and understand what are the best measures. But the ones that we've landed on for our programming is to measure broadly the reduction in humanitarian assistance needs, expressed in how many people fall into crisis in the wake of a drought. And there were some interesting findings coming out of 2011 in Ethiopia. For example, looking at those people who were on the productive food safety net and the numbers of them who did not fall into crisis, but rather were able to maintain, and part of that is defined by, did they deplete all their assets? Did they have to migrate from their home? These kinds of measures. The second one is just the depth of poverty indicator. And that is very connected up with Feed the Future and the way that Feed the Future is doing poverty prevalence measures. And so that's a long-term measure. The third is looking at a moderate to severe hunger indicator, and that measures the percentage of households that are experiencing either moderate or severe hunger. And the fourth indicator that we put into this basket is the global acute malnutrition indicator to look at overall nutrition levels.
Good, thanks. Well, Mike is weighing in with in an area that I've been doing some work on recently, and that is public-private partnerships. And he wants to know whether or not there's some ongoing public-private partnerships that you're excited about that relate to resilience.
Absolutely, and I wonder if...
you think he works for one?
I don't know. I wonder. That's such a good question. We just announced first at the African Leadership Summit our new partnership between AID and the Rockefeller Foundation to create a global resilience partnership that looks at 3 focus areas, the Horn, the Sahel, and Southeast Asia, because 60% of the world's hydrometeorological disasters occur in that part of Asia. Mm-hmm. And it's a partnership that is, it started with $50 million from each of us, so a $100 million effort. And then just 2 weeks ago at the USAID Frontiers for Development Conference, we were very pleased to have the Swedish SIDA join us as an equal partner and launch what we're calling a grand challenge for resilience. And that's basically modeling the kind of approach that we're seeking by asking for teams, multidisciplinary, multi-sectoral teams that will come together for each of those areas, initially to help define what's the problem, and then to identify some innovative solutions. And we see this as a way to complement government-led efforts. We certainly want regional entities and regional bodies to be very much with us on this partnership, but also to bring in academia, the private sector, civil society, to be thinking about what are the best ways to build resilience in your community or your area. And you know, we're very much focused on things like how do you use data better, how do you help decision making be better informed when you're trying to decide, do you sell the cow now or do you sell the cow later? You know, to take a very small example. You know, how do you know it's better to invest in your a better wastewater system for your Asian city that gets flooded every year, or you know, the dikes? You know, there's just a lot of complexity to the question, and we would hope that this process will bring teams together that have a broad enough set of disciplines that they're able to think in new ways about what the problem set is and what the solutions are. And then tap into funding that's not just earmarked for one kind of solution or another, but can really back these systemic approaches.
Nancy, over the last decade, the world has spent some $90 billion, 50% of all development of humanitarian assistance, in 9 countries. Aid has spent 75% of its humanitarian assistance in 10 countries. My assumption might be that these 9 or 10 countries are the focus of U.S. and global resilience efforts. And if that's wrong or right, one might presume that there could be a cost benefit here, and that if you can get resilience right, down the road it's going to reduce the funds that we have to expend on humanitarian. So there's going to be a benefit of lives saved and money saved. Are these the 8 or are these the 9 or 10 countries that are the focus? Or well, it's not quite that simple.
It's a mixture, and it's a mixture of places like Kenya, like the Sahel, like Ethiopia, you know, in the Horn, where you have constant cycles, and throughout Asia. I mean, the Philippines typhoon was the classic example. You know, where you just have cycle after cycle of these big weather impacts. It's complicated by what we have going on right now, which is, with the exception of Ebola, all of the crises that are sucking up a lot of time and resources are complicated by conflict, by weak or illegitimate governments. And so I don't think that we will be able to eliminate the need for humanitarian assistance in the near future. But what we do hope is that for those disasters that are relatively predictable, that communities have a much better means to be prepared for them, to not be thrust into crisis, and to be able to bounce back with resilience.
Okay. Gavin, who works with the Global Health Response and Resilience Alliance executive team, wants us to bring us back to where we started, and that is talking about Ebola. And can you outline AID's approach to resilience and Ebola?
Sure, and it's really not USAID's approach. This is firmly and necessarily a whole of government response, and the U.S. strategy across the board is really in four baskets. The first is urgently contain the outbreak. The second is addressing secondary impacts, and that includes food security and some of the economic repercussions that we're already seeing. The third is to help provide the kind of coordination that makes an international response more successful. And the fourth is the global health strengthening. The first, control the outbreak, which is the most urgent, we are focusing on providing help at both the national and county levels of these countries to have a better incident command management system, because that is one of the most important issues for getting this crisis response right. And then, as people are well aware, President Obama has pulled forward military capabilities to help us to build Ebola treatment units and to do some of the training and the resupply to ensure that we have the people and the equipment and the stuff to make those treatment units successful. Then there's the community strategy, which includes community care centers, public messaging, and intensive community outreach so that communities have the information and the means to better protect themselves.
Wow.
Oh, and a very important piece of this is the preparedness that's going on in the countries that are not yet affected but are in the region. And this is critically important, and it's trying to get ahead of what might be coming at them so that if somebody does pop up somewhere else in the region, you've got the contact tracing and the ability to do the kind of response that we saw in Senegal and Nigeria that the Center for Disease Control has been very, very much a part of.
So it's really a multi-tiered response.
That's why this is all a government. It's really it's USAID, State Department, Center for Disease Control, HHS, DOD, Department of Homeland Security. I mean, this is an all-in, fully mobilized U.S. government response, and we're going to get ahead of this, and it's going to take all of these efforts moving together.
Can I ask where the focal point is in the U.S. government? Is it you and your office?
Well, on the ground, through the Office of Foreign Disaster Assistance, response teams, we are coordinating the on-the-ground response, which includes a deputy from CDC and interface with a joint task force that the military has stood up. Here in Washington, there is, across the interagency, there are a task force headed by a senior person, and then the White House coordinates all of that. Because this thing has a huge, as we've seen now, domestic aspect. There are lots of parts to this, but on the ground, USAID is federally charged with leading these kinds of crises responses.
You mentioned earlier Feed the Future. And I presume that the resilience strategy that you're working with has to be integrated with what I would call priority initiatives like Feed the Future. How does that happen, and how do you, I mean, you know, bureaucracies are stovepipes, probably one of the big problems you face with, and how do you get it integrated across an agency like AID and in high-profile presidential initiatives like Feed the Future?
So this has been a really wonderful journey with all my USAID colleagues, because so many people were immediately gripped by the opportunity. And so there's been, you know, ultimately we're as far as we are because of the extraordinary energy and passions of people throughout AID, and in particular in missions around the world. We are helping to support that through a couple of ways. One is we have a resilience leadership team that meets every Tuesday morning with senior representatives from across the agency. About 8 or 9 of our bureaus get together, and we have a work plan that we track as we've moved through this. we're working to make the kind of changes in our bureaucratic policies that enable missions to more easily include this in their planning. Several of the missions that really deal with this, because of where they're located in places like Nepal and the Philippines, for example, they've already incorporated this into their strategic plans. So a lot of people have moved ahead in ways that are really terrific. And the commitment is within USAID to create a long-term way of having what we call a spanning unit, a group that enables us to cross different bureaus and keep this an all AID response.
Mm-hmm. Let me go back to the question that we got from one of our listeners about ownership and the gender issue. Because Ritu Sharma has written this wonderful book, To Teach a Woman. And she talks in there about the importance of women's grassroots organization. And to what extent is a successful resilience policy and implementation really tied to plugging into those women's networks where they exist and bringing them in both to help the solutions, because one of the things that Ritu talks about is that poor people have a lot of the solutions. They don't need our solutions from Washington. They've got their own solutions if we can just help them unlock them. And to what extent are you using those grassroots networks to move the policy and implementation?
You know, one of the very important things about this, which is true for all of development, is highly context specific. And that means you need to be very aware of what's going on at the community level and how to tap into solutions that may be at that level. And so this is part of what the Grand Challenge seeks to do, is to really catalyze that happening in a multi-sectoral way. I mean, communities and certainly women's networks, they don't divide relief from development. This is not a construct that has any relevance to them. And so, you know, the more that we are able to be more relevant to real life, often the real life of you know, women in these networks who can move things in extraordinary ways. And sometimes what we're seeing is, you know, there's a lot of predictive data out there that exists up here at the kind of global or national level, but very little of it is at the subnational level, and even less of it is available to people who know how to understand it. And so, you know, think of the power of a woman farmer in the Sahel who has a better understanding of what's coming at her in terms of the dry season ahead, what that's going to mean to her moringa crop or her onion crop, and how she might then be able to better plan for it. And so it's those kinds of things that I think one can do a better job of. And I didn't answer your other question about how are we integrating into the presidential initiative. So global climate change and Feed the Future are lockstep with the resilience piece, and it's really drawing on a lot of that expertise, some of that funding, because these are all part of the solution.
So your answer on the using local networks and grassroots organization, Giovanna wants to, as I interpret her question, how do you take an underdeveloped community, a poor community in an unfriendly environment, and how do you make it, transition it into a resilient community? Is it training farmers through those women organizations? It's got to be more than just training.
Yeah, I mean, you know, and it's going to look different depending on what's the problem set, what country, what part of that country are you in. And, you know, you could be relatively poor and underdeveloped and hugely resilient. But it's when you have poverty combined with an inability to bounce back between shocks that you start getting the real need. And just as an example, I went to a community outside of Jijiga in Ethiopia. So, you know, you fly to Jijiga and then you travel 8 hours on a really bad road. And the big push there has been to restore what is an extremely degraded environment so that they're not able to grow crops. They're overwhelmed at the first bit of drought or flooding. And you could stand in this one community, you could see on one side of the hills, it's all restored. And the ability to farm and to stay healthy is already hugely improved. And on the other side, you can see what how it has been degraded. And the woman who I spoke to there was saying that during the 2011 drought, they didn't have to move their community, whereas in the previous big drought, they all had to move into Jijiga, disrupt themselves. You know, they couldn't feed themselves. They were all displaced for a couple of years. That's a resilient community.
Nancy, one last question. We have 5 more minutes, and I know you have 3 more minutes because you've got to run. You've been leading not just the U.S. government effort on resilience, but you've been part of the international leadership of getting the global community to move into this space. What does that look like? Is it working? Maybe you can weave in something about the Global Alliance and the Higher Education Solutions Network.
Yeah, I mean, it looks like a lot of people who are just gripped by the importance of this, and it looks like people who are in charge of big institutions, whether it's UNDP, Helen Clark, Justine Clark at DFID, Kristalina Georgieva at the EU, who's been a tremendous champion, Valerie Amos at UNOCHA, and it also looks like leaders of countries and regional entities like Mabu Malim at IGAD, and it looks like people at the community level. So going back to where we started, I don't think this is new. I think it's been given new momentum with a context and a way to think and talk about it that creates alignment across a whole lot of players and actors. Almost all of the big development partners have come out with policies and definitions that roughly align. And it helps us rethink at a global level, what is it that we're trying to do and how do we do it more successfully? And try to move past these stovepipes that have proliferated and fundamentally gotten in our way of doing what needs to happen.
Good. Well, Nancy, those of us who care about development and humanitarian situations, we thank you for your leadership and your dedication to this. And thank you for taking the time to talk to us today.
George, anytime. Thank
anytime.
you.
How about tomorrow?
Thanks
okay.
For you, George.
Back to you, Darren.
Thank you, George and Nancy. I could have sat here and listened a lot more of this, but I know you have to run, and we're very grateful you could find the time to talk with us today. So just to conclude, I just want to indicate that the recording and also the PowerPoint are going to be made available later for download. If you have any questions that we have not addressed, and there are a few on the screen here, please feel free to send them to me, and my email address is there. Also, there's more information about this series at the website you have online. And so in the next 4 events, we're going to dig deeper into specific domestic and international social issues and their links to resilience. Those are going to include, on November 19th, climate change, on January 22nd, asset building, February 26th, mental health and well-being, and April 7th, infrastructure and communities. You have all those dates and titles on the general announcement for this series. So I won't thank Nancy here to leave, but thank her for her contribution. George, thank you so much for thinking of good questions to ask Nancy, and also taking the one from the screen from our colleagues. I want to thank my colleagues Caroline and Ariel for helping us with the technology, and especially Brookings Institution for hosting this. We hope to see you all online for the next discussion about resilience and climate change on November 19th. And really want to thank you all for taking the time to join us today.